Assalamu alaikum, welcome to Scan Diagnostics. Here, this is the CBCT of the patient that you had requested. The area of interest is the upper left 3, the upper right 7, the lower right 5 and 7, and the lower left 7. Let's start with the upper left 3. As you can see, we've got a crown and a endodontic treatment done. This is the transaxial view of the tooth. Now, unfortunately, we can see that there are multiple voids within the root canal system. There we go. That's one. That's two. We see a very slight bit of periapical periodontal ligament thickening, but other than that, we see major voids. We can't see any cracks on this view. Let's move on to the upper right 7. We've got BTRs, but along with these BTRs, we have absolutely no bone width, as you can see right here. We've got approximately 11 millimeters weight, no bone height, only 2 millimeters of bone height. So a lateral window sinus will be needed in this region for any kind of implant placement. Moving to the lower right 5, we've got endodontically treated BTRs present here as well. Very, very thin ridge towards the crest, and then we've got this osteosclerotic activity going on the 5 here as well, that you can try to see. So very dense D1 quality bone, but if we do have to measure, so just below the crest we've got 5 millimeters of ridge width with 13 millimeters of height. There we go. So moving to the lower right 7 region, again very thin ridge D1 quality bone, D1 to D2 quality bone, 5 millimeters of ridge width with 9 millimeters of height. Implant placement here should be done after considering the occlusion. Moving to the lower left 7 region, there we go. Here we've got good D2 quality bone. We've got 5 millimeters of ridge width with a good 12 millimeters of height. So here implant placement should go uneventfully. Slight bit of apologies. I was considering the lower right anterior edentulous area as a premolar. My apologies significantly. That's the lower right molar, and the area we showed you at the distal of the lower right segment, that's the lower right 8. So we've got the lower right 6 missing, and the lower right 6 unfortunately has very thin ridge and also a osteosclerotic event going on here, as you can very clearly see. So this will need to be kept in mind because this can significantly hamper implant placement. We have placed virtual implants. These implants, other than the lower left 7, we don't have good bone support in any of the implants. One last thing that needs to be kept in mind is the impacted lower canine, which we can see right here. This is an impacted tooth which is doing very well. No radiolucency or no cystic lesions can be seen around it. Thank you very much.